Now on Facebook recently we had this post from Amy S. She writes, "Do I need to worry about a vitamin D deficiency?" Well, we're here with Whitney, who has wanted to know the very same thing about vitamin D. And so have you been taking vitamin D supplements?
I have not. I'm actually
Yeah.
from the Northwest, which we don't get a lot of sunlight. So I was always kind of wondering if I was low or not.
So do you get 30 minutes or so in the sun? Do you get outside and kind of let the sun hit you so you make that natural vitamin D?
I do now. Now that I'm in Southern California, I get a little bit.
And you're worried about it. You know why people are worried about vitamin D? We've been finding out so many different things about links between low vitamin D and the different disorders, cancers, and things like that.
So there are 5 reasons why you want to make sure that you have adequate vitamin D levels. Let's go through them, Dr. Lisa.
Well, one of them is a decreased risk of cancer. Now, again, these are there's conflicting studies that it can be a decreased risk of cancer and growth of certain tumors. But there is promising research out there that shows that the active form of vitamin D, citriol, does most of the work, okay? And that helps to decrease some of the cancers. So that's a good outlook, even though, again, there are some conflicting studies. Also, it may reduce your risk of cardiovascular disease and strokes. Now, again, these are preliminary studies that show that a deficiency in vitamin D has been linked to heart disease and death. Some studies indicate that the risk may be as low as 30% in those who are given supplements. And of course, what we do know and why you should take it is it does reduce the risk of fractures. So that's why you most definitely want to take vitamin D.
And there are other things that vitamin D levels can affect. If you're low on vitamin D, you may suffer from more chronic muscle pain. So vitamin D may reduce that. Muscle pain and weakness are commonly reported symptoms, like I said, of vitamin D deficiency. Number 5, it can also, believe it or not, reduce the severity of asthma attacks in some kids, because if kids have lower levels of vitamin D, it is associated with more severe attacks. So actually, children who were taking vitamin D supplements who are low had a 6-fold reduction in the number of asthma attacks compared to those on placebo in one particular study. Make sure, if you're low on vitamin D and your doctor recommends you're taking it, you take the right form, vitamin D3. And that's very important. It's the most readily absorbed. But here's the other thing. You need to get it checked because your vitamin D blood level should be between 30 and 100. Whitney, you want to know what yours are?
I do.
So between 30 and 100, you're at 30.8. So you're in the very low level of normal. And you mentioned you're not getting a ton of sun, right?
I'm not.
And so here's some things you need to look for. Look for foods high in vitamin E, milk, fish, fortified foods like orange juice, even a lot of breakfast cereals are fortified. Good old-fashioned way to get it, sunshine, 10 minutes, maybe 3-4 times a week on your arms and your legs without sunscreen. That helps your body create more vitamin D naturally. So make sure you're getting some of that sunlight. And I think that the key would then be eat those foods high in vitamin D and then get your levels rechecked to make sure that you're in that proper range.
All right.
What do you think?
I think we need to do that.
Thank you so much.
Thanks.